I think the biggest challenge when you go to a conference like this with so many brilliant ideas, with so much brilliant insight, with so much information to share, you walk out the door, and all of a sudden, the challenges of the world as they exist at this moment in time hit you squarely back in the head. So how do you innovate? How do you keep your enthusiasm? How do you keep changing the world? How do you take your ideas and ensure that you can keep charging forward with them, so that the world can change and so that we can transform this massively complex healthcare system? Well, I want to give you 6 ideas that I think you need to focus on as you leave the conference. Number 1, as soon as you go out this door, you're going to have to put your armor back on. Okay? The reality is you will walk out this door, and the economic dark clouds are out there, and all the aura of everything that is going wrong with the global economy will hit you square in the face. And not only that, what makes it more challenging is if you work in the healthcare system, or if you're a technology company, the challenge as soon as you go back to work is this. Something I've learned in dealing with innovation through the last 15 years is that in every single organization, there is a group of people who wake up every single morning, and the first idea that comes to their mind is this: how am I going to kill innovative ideas today? Seriously, this is what they do. I've learned this. They get up, even before they think about, reaching for a coffee or a cigarette, they are thinking, how am I going to kill innovation today? And I've written about this in articles. I've spoken about this on stage. I've written this into books. I call these people the innovation killers. And what they do is as soon as you get back to work, they will work to sap the energy out of you in terms of all the great ideas and enthusiasm that you've built up through the last several days. And they do this through the use of a whole bunch of code words and phrases. This is what you're going to encounter. You're going to go back to work. You're going to be full of ideas. You're going to be full of positive energy, full of initiatives and things we could be doing. And you're going to go into a meeting, and people are going to come back to you with the innovation killers. What do they do? What do they say? They say things like, well, you can't do that idea because it won't work because we've always done things this way. They will come at you with phrases such as, it's the dumbest idea I ever heard. They will come at you with concepts that it's too complicated to work in the world of healthcare. They will say to you, the issues are too large and too big to pursue. They will say to you, it can't be done. The boss won't go for it. The funding isn't there. The challenge is, as you leave here, you can lose your enthusiasm. But here's the thing. We know how big the technology and innovation is going to be in the world healthcare system. We know that, the challenge that we're faced with, it's huge. It's massive. You heard some of the numbers. Healthcare could be 70% of some states' GDP within 5 to 10 years. Folks, the scope of this problem is absolutely astounding. And everything you have heard in the last 3 days provides everything that is necessary to fix the scope of the problem that exists.